I just want to cover, essentially, the issue I want to cover is generating more appropriate, relevant clinical research for evidence-based medicine and, of course, for use in systematic reviews. I want to compare why practice is potentially a better place than academia. I want to talk about the quality of research questions, and I want to talk quite a bit about the reviewing process for clinical research and why I think it should change. You know, I think it's a given that we would like more research. I think Rachel was the one yesterday who was saying, you know, there's lots of literature out there, and of course there is. There's very little compared to human medicine, and of course there are obvious great big holes. And I was saying to somebody today, I don't want people to go out and do a clinical trial to show that tetanus vaccination in horses saves lives. I think that's a given. We can accept that without having a randomized controlled trial. But there are plenty of other procedures that we follow that we know in our hearts that we're relying on very old evidence or no evidence at all, and we should do something about it. And I always try and sell my approach to sort of teaching people how to do clinical research is we want more research and we want better research. But by better, I don't necessarily mean the same thing that you do, and I'll come back to that in a minute. Why is the practice the right place to do it? If we have evidence-based practitioners and we're increasingly training the new generation of vets to at least think in this direction, then as they search for answers to their questions that are pressing needs to them in practice, they themselves will identify for them in their practices what they need to know. And if there's a good literature out there, that's fine. But if there isn't a good literature out there, then it's their question and their population, and the right place to ask these questions. And if you have learnt to criticize or to do an appraisal of clinical research, which is essentially what a lot of evidence-based medicine is about, surely you have identified what the good features of a research study design are, what the bad features are, and you could probably just take the one that you think's flawed, fix the bits that need fixing, and then run your own design. It isn't rocket science. I'm an incredibly derivative researcher. I only ever do things that other people have done, but change enough of it to get it published under my name and to get some sort of reputation. And if somebody else has done it before, got it to work, got it past the peer review system, it just increases the whole confidence of doing it. So that's how mugs like me manage to get on in academia. And another aspect is the population that you're looking at. The population that you as a practitioner are most interested in is going to be the one you look after. And even if your clinical research is only applicable to the cats and dogs or hamsters in your practice, that's fine. That's the population you face every day. It may be biased, there may be all sorts of problems with that research, but you have answered your question. And generally, I find when I'm working with practitioners to teach them how to do clinical research, they find it interesting and enjoyable. It's sort of fun to do, really, particularly if you take care not to do things too complicatedly or in too much difficulty. Why is academia a bad place to do clinical research? Well, of course, it's not a bad place to do clinical research, but the net result of what hits the veterinary literature has limitations. Firstly, it tends to be the wrong population of animals. It tends to be people who have insured animals or have considerable resources, and it tends to be referral type work. It's often retrospective because the majority of the people doing this research are people on clinical training programs of either 1 year or 2 year. They are all trying to get diplomat status with their relevant specialty board. They have to have 1 or 2 or more clinical publications, research publications, and they've got a very limited window of opportunity to do it. So they have to think very hard about can they finish it within the time available. The easiest way to achieve this is just to dig through the records and do a retrospective study, cohort study, case series on what they want to do, or a largely laboratory-based type project. Often very technical, especially because they are so interested in some interesting aspect of renal physiology and a rare inherited disease of Purkinje's, that's where they want to do the research. And so they do answer the relevant question, but sadly, you and your practices don't see that very often. And generally, clinical research in vet schools is driven by the need to publish rather than the true desire to answer questions. And that's probably doing my colleagues a disservice, but I think that's a not unreasonable interpretation of what actually happens. This is an example of a paper that came out of practice, and I have to confess that so I got in on the end of it. I really had very little to do. Chris Little came to on our clinical research course at Cambridge to answer this question. He is a cardiologist. He reasonably frequently, is trying to do a thoracic examination, trying to auscultate the chest, and the cat is purring loudly and sonorously. And he was aware, he'd used in the past various techniques to stop cats purring. He did a little pilot study trying all sorts of things and narrowed down the 3 best candidates to, as I recall, blowing in their ears, spraying an aerosol nearby, so just a standard aerosol, it happens to have been or carrying them over to the sink in the corner of the consulting room, running the tap. And as you can see from the results, it's a fairly clear result in as much as if you blow in their ears, doesn't seem to affect them too much. If you spray an aerosol, they don't stop. They stop about half the time. But you definitely get a clear effect if you put them near running water and they stop purring. Very handy piece of information. This is not going to be the most cited paper ever in the Journal of Small Animal Practice. Is it going to be of help in deciding how to stop cats purring? Will it change how we teach how to cats stop purring? Well, probably. It's got impact that I think is of direct relevance to practice. And one of the things you'll notice is that the blows didn't get attempted that much, and the tap was attempted more times. And that was because the study design he came up with was a block randomization, and each cat was offered a random method to stop it purring first. If it failed to stop purring, it then got randomly one of the 2 remaining ones, and then if it still continued to purr, it got offered the final option. And then that sort of design means that an unsuccessful method will be tested much less than the most successful method. And this leads to any statistician in the audience will be thinking, crossover studies, really tricky analysis, and that's to some extent true. And that's where I came in to sort of naively try and do the statistics, and you'll hear later about how appallingly dismally I did that. So doing good clinical research is really all about asking a simple question. And there is one absolute and fundamental criticism of almost all clinical research, is that no one can ever resist the temptation of measuring something else while they're there. So you never get a study that says, the question we were asking is, does this drug reduce the level of this hormone in the blood or this biochemical marker? No, you always have the entire panel of everything that can be measured, just in case our hypothesis isn't proven, because we want to find something else that's... There is nothing wrong with collecting lots of data, and that is often very useful to establish the demographic of a population or its freedom from other diseases, concurrent diseases. But it really helps if right at the front of people's mind is a simple question. And when we're teaching evidence-based, when we're teaching appraisal, we're always telling you to look for papers like that. And I always tell people, if you're in any doubt about a question to us, just say, what is the piece of information that if I had it or if I gave it to a colleague in a decision-making process, it would actually switch what they use. So interventions of all sorts lend themselves very well to this sort of design. And if I don't say it again, remember, simple, focused research questions are the answer. Another thing that I teach when I'm teaching clinical research, and I just, when I first did that, I just lifted this from a human medical clinical research book, is the acronym FINA. So we go through, is it feasible, interesting, novel, ethical, and relevant? Probably one of the biggest mistakes I've ever made, because this is a lousy acronym. Feasible, certainly. Okay, to make research easy to do, it does help that it doesn't involve a vast amount of cost, either your time or financially. It helps if you're not asking owners of cats to put a pill the size of a suppository down the poor thing's throat. And essentially, anything that can go wrong in clinical research does go wrong. And I've got several alumni of my course in the audience who have done some clinical research and will no doubt say, when I started my project, I thought it was going to be sort of 3 months and it would be straightforward. And they always come back and say, it never occurred to me that X, Y, or Z would occur. So it does. But feasibility is not beyond the realms of anybody with a bit of common sense. Interesting. Well, yeah, of course it's got to be interesting. I mean, it's almost a stupid thing to do. You wouldn't be interested in doing the research if it wasn't something that was interesting to you. But this acronym suggests that it ought to be interesting to other people. Well, the bottom line is, if it's something that is relevant and appropriate and interesting to you in your practice, who cares what anybody else thinks? The one advantage of getting old and middle-aged, paunchy, is that you finally learn to not be over-affected by people thinking you're mad or thinking you're stupid or whatever it happens to be. You learn to be comfortable in your own skin, and if you find it interesting, I'll find it interesting, is what I say to people on the course. Ethical. I always used to think that ethics was just a matter of common sense. Clearly, you're not going to give some horribly toxic chemical to some poor animal. But over the years, I have settled down, grown up, and realized that it is important to go through some sort of formal process. This formal process does not necessarily have to involve external ethical review. You can convince yourself quite convincingly sometimes that, for example, a retrospective survey of client record data can be done without necessarily going through ethical review. But it is surprisingly, even in something like that, where you can accidentally uncover the fact that a certain racehorse that's now worth billions of pounds at stud actually had some sort of congenital disease when it was younger. And so if a patient is identifiable for any reason, you should be worried about it. It's covered by the Code of Conduct, and it has been raised elsewhere in the meeting, but it's worth looking at the result or the findings of it. There was a committee to look at this at the RCVS, which I was on, and essentially, if anybody is worried about ethical review, I am always happy to put it through the Cambridge Vet School Ethical Review Committee. One of the things that upset me when I was on the ethical review sort of committee was the number of academics on that panel who suddenly said, we can't possibly offer ethical review to all and sundry. We'll be overwhelmed. Well, I've been overwhelmed as the only person willing to stand up and offer it by at least 2 or 3 ethical reviews a year that I've put through, and it hasn't been too onerous. I would love to be in the situation where we were overwhelmed. Relevant. It's relevant if it's interesting. The idea of relevancy is just saying that if you want to measure something about a disease or about diagnosis or an intervention, then maybe it ought to be something that is at least possible to do in practice rather than something that's purely of scientific interest. But because I am basically a scientist, it's all relevant to me because it's all interesting and scientific. So I don't really go with that one either. And novel is the one that I would really like to throw out completely, because we always, we drum it into residents and interns about, the importance of doing something that's novel, exciting. Actually, if nobody ever repeated a study, there would be no research synthesis. And one of the problems we have, people are saying, well, shouldn't we just get one deep to start with? Well, no. I think what we should do is say, if there is an issue that we think is important, it deserves multiple studies. It deserves studies in Ohio, Britain, France, wherever it happens. It needs to be done with old animals or young animals. It needs to be done on organic farms and inorganic farms, whatever you call inorganic farms. You get my drift. Repeating research. Now, why is repeating research even better for practice-based research? Well, because it makes it easier. Because all you have to do is to take the study that somebody did in Ireland or Germany, follow their methods completely, because it will have been a well-written paper that's been through peer review, so the methods section will contain enough information for you to duplicate that study, and it'll even tell you how to do the statistical review. What could be easier? Why aren't all the practitioners out there doing loads of these studies? Anyway, so I don't want to I think fire would be better than fine, and probably even F and E are probably the only things that really matter. Case definition is a really important issue, and I'm just flying through this because I want to spend more time on the more controversial stuff. But we as academic researchers get obsessed with, say, a diagnosis that should be confirmed by PCR, should be confirmed by virus isolation. Actually, is that important if you're a practitioner and you diagnose kennel cough on history and a cough, and you never send them out for microbiology, and that is the population of animals that will receive oxytetracycline or whatever you treat that with these days? My clinical ability or knowledge is about 20 or 30 years old now. And so if you come up with an intervention that for that defined population has an improved outcome, however you measure that outcome, but it's the outcome that is easy to measure in practice, you have identified something that is worth doing using clinical research. So don't get too bogged down in case definition or outcome, other than it should be directly relevant to what you do. So, peer review, which is where I want to sort of stir things up a little bit. The reason that practitioners don't do research is partly the peer review process. It should be a nice, simple, straightforward process by which some people who have a bit more knowledge and a bit more experience look at the way that the study has been written up with particular regard to the materials and methods, and possibly a few claims that are made in the abstract and in the discussion on what the results actually mean, and point out to the author any major flaws that would misrepresent what was actually done. Bear in mind, and is Celia still here, or has she gone home? Oh, she is. So we have one editor who, and I don't want Celia to think that I'm going to be picking on editors at this thing. But she will know that editors often find it very difficult to find someone who will do reviewing work in a timely fashion. So I am one of the guilty people who nearly always takes a couple of reminders before I actually get it in. And reviewers are human beings, so occasionally we review something, we don't notice some particular flaw, or we happen to be authors on one of the papers that is now our work that has been very widely regarded as the best piece of work in this area, and definitive almost, if I could say so. But this new study doesn't seem to agree with what we found. And now I look closely, I do realise that maybe there is a bit of a flaw in what they did, and I think this really shouldn't be published because it's clearly going to mislead a lot of very important clinicians, and these aren't necessarily people who can assess this literature as well as I can with my years of experience. So it is actually, now I come to think, it's my duty to reject this paper because animals will suffer. Okay? And I'll tell you something else, that when I was first writing papers, when I was doing my residency, I wrote the most definitive study on this. It took months and months of hard work, and it took 16 rounds of peer review before I got it published. But I am a better, stronger man because of it. And it does these whippersnappers no harm to go through a similarly savage experience. They'll be stronger and more vigorous as a result. So let's go back to my example. And I just wanted to know that I'm not bitter about this. I don't take it personally. So here was this study, which I happen to think, and I honestly had nothing to do with the design of the study. Chris Little had done it. The only thing I did was a bit of untidy statistics right at the end of it. So it actually took 4 rounds to get this little study published. It had, and the flaw that I made, and I'll throw it out there, I had thought I might get away of just doing a simple chi-square comparing the three proportions and forget the fact that they weren't, strictly speaking, all independent. And nobody's going to notice that in a fairly low-level clinical journal. That's the sort of arrogance that is typical of academics. So the interesting thing is, of course it was noticed. Hadn't I even stupid? Everybody knows that. And the person who spotted it was not the statistical reviewer. So it went to 3 reviews, one of whom was a statistical reviewer, and one of the non-statistical reviewers said, I'm not sure about this, but I have a feeling that you can't really use a chi-square for doing this. But what really upset me was there was a plethora of irrelevant, meaningless comments about what type of aerosol spray was used, and because it was a particular manufacturer, shouldn't we be really specifying? And when we walked to the sink, how close was it? How many steps away? And was it consistently done? And how many of these cats stopped purring spontaneously? And wasn't that really the most important thing? Because actually, none of the things you've done. I'm sorry, these were fatuous, meaningless. These are people who do not have enough to do. They filled up sides and sides of A4 to get this done. And the comment that really got me was this one, which was, research from practice is very welcome and extremely important. But in order for such research to be appreciated in the same form as that from elite research establishments, why did I get the feeling that the author of that review might possibly himself, and I have a feeling it must have been a him, come from an elite research establishment? And that is one of the things that JSAP, and this is where this was sent, does, is it blinds the reviewers to who the authors were. And because of the way the study was done, it was conducted in practice, was obviously a practice. It never occurred to them that maybe one of the authors came from probably not an elite university, but a good enough university. Now, why does it, we were discussing over lunch, we actually are used to arguing. I have been known to be thrown out of people's office for getting a bit too carried away with arguing a point. But that's how academics work. And we're sort of used to being told off or being told our thoughts are stupid or, should be dealt with in some way, and it's loud and voluble and sounds a bit aggressive and it's all a bit alpha male. So we're sort of used to it. But of course, not everybody is, okay? And when the authors of this paper got their first set of reviews, they just assumed that was it. They said, oh, it's rubbish. We can't have it published. And they were quite upset because they put a lot of effort into it. This is unnecessarily savage reviewing. It doesn't help. And on the whole, we don't treat research now the way we did 20 years ago. So there's an interesting comment about when I last reviewed papers 20 years ago, there was all this rubbish getting into the... And there was very much an issue of saying, the reviewer is a very important gatekeeper. It's important that we don't get misleading material into the public domain because your average reader couldn't possibly look at the materials and methods and the results and work out whether it was good evidence or bad evidence. They rely on the experience of the author. And reviewers, really nowadays should be told the only thing that matters is really the materials and methods and the results. And in fact, the results shouldn't be reviewed, and I'll come back to that in a minute. And to that extent, that's why guidelines are reporting guidelines. So they actually say, here's a checklist of things that should be included that ensure that everything in the materials and methods is where it should be. They should concentrate not on the style of the paper. And by the way, if you are an anonymous reviewer, if you are a reviewer, if you're going to point out that there are 3 important papers that have been missed out of the introduction, and they all have the same first author or the same last author, we will probably guess who you are. Okay? So again, self-interest. And the only thing that I would say that, in a discussion that, reviewers should maybe have a responsibility is if there is an unsubstantiated claim, it should be diluted on it. And discussions are a place to talk about limitations of a study. So, and I personally think reviewers should be told that the length of their review is not an indication of the power of their intellects. You know, it's like a PhD thesis for those of you academics. People who have really good PhDs have small theses. People who are a bit weak have big fat ones, is the general rule. And all I can say is, you know, I was very grateful that by the time I did mine, you know, paper was getting thinner and you could fit more on a page. Anyway, so one of the issues, and it's in many of the instructions to reviewers, is a question, is this work original? Well, who cares if it's original? You know, actually, I care that it's not original. I would like it to be a duplicate of another study because it improves our chances of doing some original work. One of the things that happened on that paper that I submitted was that at one stage, I complained to the editor and said, look, these people are asking things that I think, frankly, are completely unreasonable. But we can make these changes, and if you decide and you tell me to make these changes, we'll do it. But otherwise, you know, would you be prepared to overrule the reviewer number 3 or whatever it was? And what happened? Got sent to a 4th reviewer, and I got another set of comments back that, funnily enough, were different from all the other comments back. You know, we could do with journal editors who are prepared to make decisions. And one of the worst examples of bad reviewing and bad editing that I ever came across was a review that came back from an eminent, whoever it was, because of course you don't normally know this is a reviewer, who said, this study, you know, there are no methodological issues with this study, but I've been an oncologist for 30 years and I do not believe the results. Now, what was worse is, you know, I can't work out what I think was worse, the reviewer making a comment like that in the first place, which to me indicates they're not fit to do a review of paper, or the editor for sending that review to the authors, because that implies to me the editor didn't even read the review. And I do understand if you are a busy journal editor, you can't necessarily read every review and certainly not read every paper. But, you know, editorial boards need to think a little bit about these things. And I've been publishing, you know, I'm very big-headed, I want to sell how clever and special I am. But just recently, because I've been doing some collaborative work in human field in some fairly, you know, prestigious medical journals, I was amazed at how tiny the reviews come back. And because I've been publishing those papers, I've now been asked to review a couple of papers. And one of the instructions that came back from one of the highest impact journals was a maximum of 3 major points, a maximum of 3 minor points. They didn't want anything else. If you can't pass or fail it within that limit, then they weren't interested. Anyway, I was going to talk about a way round, but I'm not going to because I've run out of time. I just want to point out that the internet has changed everything, and there really has been, there is a change in how we do things. And what I was going to talk about at this stage, I'm going to summarize it, is that actually this morning somebody talked about, I don't want the internet to be polluted or the literature to be polluted with low-quality studies. I don't care about low-quality studies anymore because I actually know that all of you can recognize a bad study when you see one, and what I want to see is a good description of materials and methods and their data set. So I don't care if it's an underpowered study, because that data may still be useful in another study. But if I have their raw data and I am happy with their methodology within the limits of I can make all the decisions about whether it's good or bad myself. And that's what happens. You know, when my kids search the internet, they don't do what my grandmother used to say, or my mum says when she does a Google search, is, it's full of rubbish. I've done a search and all I've got is 60 hits for things that clearly are not relevant. Well, my children do exactly the same search. If it's not focused enough, they're savvy enough to try another set of search terms, and they scan down that list incredibly quickly and spot the things that are interesting. It's a different skill set. So I think that's what's changing us. And we used to be important that bad stuff didn't get into the literature. There is no such thing as a bad study as such. It's actually a bad interpretation of a study or a bad conclusions made from a study. Because actually, if you wrote up a study and said this is a seriously flawed study that cannot reach a conclusion, who's to complain? That's just being honest. Anyway, we teach this stuff at a short course at the vet school, and it would be lovely to have you on it. If you're interested, just go to the Cambridge Vet School website where we have a page up there. It's a didactic teaching. We basically, the best way to learn to do clinical research is actually by doing it. Run each spring, not much money. And that's it. I apologize for ranting and for going over time, but thank you for listening.